To discuss this further, we're joined on the line by Francesca Sangiorgi, pardon me, who's Senior Director for Program Development, Communications and Engagement at Save the Children in Somalia. Very good evening to you. Thank you so much for joining us and welcome.
Thank you so much for having me.
It's been 15 years since the devastating 2011 famine, yet millions of children in Somalia are once again at risk. Are we witnessing history repeat itself? Talk to us about what's happening on the ground.
Thank you. Yeah, as you correctly mentioned, it's been 15 years, and back then, 250,000 people, half of which were children, died as a result of the famine. What we're seeing on the ground is increasing malnutrition rates. If we compare the number of admission of severely acutely malnourished children in our stabilization center in Baidoa, in the center of the country today compared to January this year, it has increased by 3 times. And if we compare the first 6 months of this year with the same period last year, we saw an increase of over 170% in number of cases of acutely malnourished children. So we are seeing similar warning signs, and we really need to make sure that history doesn't repeat itself.
Because as we look at some of the stats, research showing the Horn of Africa has experienced one of its longest and most severe droughts on record. How much of the current humanitarian crisis can be directly linked to climate change?
Yeah, so recent studies concluded that climate change has made this multi-year drought 100 times more likely. So what we have seen, for example, in 2022 was a drought that was considered the worst in 40 years, followed immediately by end of 2023 with floods considered the worst in 100 years. So we're seeing this event being a lot more frequent and more intense in nature than in the past. And while some of these phenomena are recurrent and cyclical, how intense and frequent it's been, it's not what we've ever seen before, and it's been accredited to climate change.
And of course, children are often the first and the hardest hit by the ripple effects, climate shocks. What are you seeing on the ground in terms of, nutrition or malnutrition, child displacement? I mean, how are you seeing the bigger impact?
Yeah, as I mentioned, our stabilization in Baidoa has seen a very direct impact. The doctor the other day was telling us that, he has never in the past years seen such an increase in cases as right now. The impact of drought is very severe because, as you mentioned, children and families get displaced. That means that it's more likely that disease can spread in overcrowded places. Unhygienic condition can also further push children in malnutrition. And then the drought with, failure of crops and livestock dying is directly impacting on the ability of children and families at risk to access food and have a stable income.
And do you think at all that, are there sustainable climate resilient solutions as you speak about the disease outbreaks? I mean, we're learning of diseases like cholera and measles, all linked to climate conditions. Do you think, when it comes to some solutions that can help communities protect children from future drought and food crises, what would such a plan look like as we try and curb and prevent and assist?
Yeah, there definitely are sustainable solutions. Communities are the first one to implement this when possible. But, sustainable water infrastructure, agricultural practices, including, for example, the use of drought-resistant seeds, and same with sustainable health infrastructures are all really key to ensure that communities' resilience is protected even in times of crisis. While at the moment, what's happening is every shock impacts so hugely communities that then the more frequent this become, the less time they have to be able to stand back on their feet. But these solutions exist, and with the sustainable investments, looking into building the systems, we can really ensure that communities most impacted by the shock are protected.
And very lastly, I mean, just an expansion to that response there. What are some of the urgent actions needed now to prevent another famine and ensure that children are not going to be the ones who continue to pay the highest price of climate change?
Yeah, firstly, and I'm stating the obvious, but obviously resources are really key right now
Yeah,
to build the
absolutely.
systems that we just mentioned, but also for immediate scale up of life-saving response. What's happening is we're going through a period of extreme needs in Somalia, yet because of the funding cuts, we don't have the adequate resources to respond. Right now, only 1 in about 8 people that requires assistance is being provided with support. So resources are really key to act now, but also to build resilience over time. We need to also scale up with preparedness and anticipatory action that are key to protect communities ahead of shocks happening. We shouldn't wait for shock to materialize to then respond, but we can act ahead and really protect communities at risk. And I think last but very importantly, Somalia is one of the least contributing countries to climate change, yet is one of those that is paying the highest price because of it. So countries who have been higher contributors with higher emissions should really support countries that are being impacted the way Somalia is.
Yeah, absolutely. Thank you so much for sharing that with us and speaking to us this evening. That was Francesca Sangiorgi, who's Senior Director for Program Development, Communications and Engagement at Save the Children in Somalia.